Hey everyone, Dr. Lloyd Stegemann here from the Better Way Center in Corpus Christi, Texas. If you've thought about bariatric surgery, you may wonder, do I even qualify for bariatric surgery? Well, there's a number of criteria that can determine whether you qualify or don't qualify. Interestingly, these criteria were originally determined by the National Institutes of Health back in 1991. Ancient. And back then there were only two procedures that were done. One was a gastric bypass, and the other one was an old operation called a vertical banded gastroplasty that we don't even do anymore because the long-term results were really not good. And all of those operations were done through big open incisions, meaning that wound healing was much harder, you were off work for a much longer period of time, and the risk was much higher. So back then in 1991, the NIH decided that if your body mass index was above 40, so for women that's about 80 pounds, for men that's about 100 pounds over your ideal weight, then just because you were carrying that extra weight, you were eligible for bariatric surgery. That it was safer to do bariatric surgery than it was to continue to live carrying that degree of weight. And so that body mass index of 40 has stuck. If you were between 35 and 39.9, again that body mass index 35 to 39.9, you had to have some health condition related to the weight that's going to get better with weight loss in order to qualify. So most insurance companies will use diabetes, high blood pressure, sleep apnea, needing a joint replacement, having heart condition. All of these would still qualify for bariatric surgery. If your body mass index was below 35, you did not qualify for bariatric surgery under the 1991 NIH criteria. Now, I have to say, bariatric surgery is one of the only, in fact, I think this is the only surgical specialty that I know of that let the government decide when our operations were appropriate. Most surgical societies do it themselves. They come up with their own criteria of when operations are appropriate. So our national organization, the American Society of Metabolic and Bariatric Surgeons, along with the International Society of Obesity Surgeons, came up with criteria in 2022. So they've just been released last year that updates the 1991 criteria. Under the new criteria, if your body mass index is above 35, you qualify for bariatric surgery. You no longer have to have a medical condition related to the weight because simply carrying that degree of weight significantly impacts your health and quality of life. If the body mass index is between 30 and 34.9, then you need to have some condition related to the weight that's going to get better. And again, typically this is going to be, diabetes, high blood pressure, the other ones that I've listed before. And those are not being well treated with medications. Those numbers, those BMI numbers, have been adjusted for those of Asian descent because weight in this group starts having a negative impact on health at lower weights. In the new criteria as well, it needs to be done in a multidisciplinary program, meaning that there is an entire program of nutritionists and support staff to be able to help you after your journey as well. Now, most insurance are still using those old 1991 criteria, but we are starting to see the new criteria infiltrate into some of the insurance companies. And I fully expect in the next couple of years, all of the insurance companies are going to move over to the new criteria. But you'll need to have your program look at your particular insurance to decide whether or not you're eligible under your plan. Now, if you are a prompt pay or a cash pay patient, meaning you're going to pay for your operation, those criteria, you do not have to meet your insurance criteria at that point. And that will be more up to your surgeon to say, yes, for you, I think surgery is a good option. So those are the current criteria that are available and that we all use right now. So what I would encourage you to do is call the program, find out exactly what your insurance, if you're using insurance, entails. If you enjoyed this video, I encourage you to click leave a comment, and then subscribe to the channel, and come back and get some of the great information that's presented from many of my other colleagues on this channel.